Assalamualaikum doctors. In this video I am discussing myasthenia gravis history. So myasthenia gravis history, we know that myasthenia gravis features are they have diplopia, dysarthria, that is dysphonia, descending weakness, deep tendon reflex are preserved, snaring voice, faces, nasal voice, nasal regurgitations. These are the features. So the eye symptoms of myasthenia gravis are droopy eyelids, they have ptosis, blurry or double visions, diplopia. Sometimes these are the only symptoms. Okay. So the task of myasthenia gravis is that 7-year-old with history of fatigability, reduce the exercise tolerance and recurrent chest infections. History of fatigability, reduce exercise tolerance and recurrent chest infections. Another is the difficulty in walking or difficulty in swallowing. These are the tasks can become. So first we will analyzing the chief complaints. Ask first, are they started together or one by one? Then start with the serious one first. Onset course and durations. Anything make it better, anything make it worse. Timing at the end of the day. Increase with fatigue, tiredness and stress, relieved by rest. Site of weakness, unilateral or bilateral. Where starts fast? Does she have weakness in going up and down the stairs? Any weakness on combing the hair? Any abnormal gait, any abnormal movement, any behavioral changes, any abnormalities in the eye like droopy eyelid, any concern regarding vision, diplopia, any redness or puffiness, asymmetry of the face, any concern regarding her hearing. What about her sensation? If you but something cold on, can she feel it? Is it associated with headache? Any morning vomiting? What about her way of walking? Nasal sound, interrupted, understandable, occur at certain time, dysarthria. Any problem in swallowing to fluids or solids? Dysphagia. FWASL, fever, weight, activity and sleep. Any other concern? Any chronic illness or long-time medical condition may be with other autoimmune disease. So we know that is a chronic condition, myasthenia gravis, weakness feeling, and at the evening it is increased at the end of the day. Chief complaints come like a history of fatigability, reduce the exercise tolerance and recurrent chest infection, or difficulty in walking or difficulty in swallowing. So we will ask the analyzing. Ask first, are they started together or one by one? Then start with the serious one first. Onset course and duration, anything make it better, anything make it worse. Timing at the end of the day. Remember, very important timing at the end of the day. Increase with fatigue, tiredness and stress, relieved by rest. Site of weakness, unilateral or bilateral. Where starts first? Does she have weakness in going up and down stairs? Any weakness on combing her hair? Any abnormal gait, any abnormal movement, any behavioral changes, any abnormalities in the eyes like droopy eyelid, any concern regarding vision, diplopia, any redness or puffiness, asymmetry of the face, any concern regarding her hearing. What about her sensation? If you but something cold on, can she feel it? Is it associated with headache? Any morning vomiting? What about her way of talking? Is it nasal sound, interrupted, understandable, occur at certain time, dysarthria? Any problem in swallowing to fluids or solid, dysphagia? Fever, weight, activity, sleep, any other concern, any chronic illness or long-term medical condition, maybe with other autoimmune disease. Then we are going to the systemic review. MSK, any skin spots, any swelling in any part of the body, any hypo or hyperpigmented lesions in the body, vitiligo, any hair loss, alopecia. Then chest about the recurrent bugs, cough, how many pillows using during sleep, CVS about the heart racing, exercise intolerance, chest pain or shortness of breathing, especially on lying down and fainting attacks. GIT about the tummy size, tummy pain, throwing up, describe for me his poo, loose or constipations, yellowish discoloration. Urinary about the pee concern, polyuria, polydipsia to exclude diabetes mellitus. Anyone measure her blood pressure? Remember, autoimmune diseases are friends. Celiac disease, diabetes mellitus, myasthenia gravis, thyroid. These are the friends. They come together. Then endocrine, hot or cold intolerance, thyroid, any lump in the neck, anyone measure his blood sugar. Then hematology, payload, recurrent bugs in the body, swollen glands in the neck, numbness in the fingers, that is pernicious anemia. Past history is 5TOA, any trauma, traveling, blood transfusion, surgery. These are in details. Ask about any head trauma, drugs. If he is chronic case, ask about his medications, compliance and drug level. Other drugs which may interfere with his conditions: beta blocker, azathioprine, ciprofloxacin, nalidixic acid, neuropsychiatric drugs, penicillamine, gentamicin. Remember, some drug causes exacerbated myasthenia gravis condition. So drug history very important. Previous any condition like when discovered, by whom, how it was presented, is he admitted to hospital, in normal ward or ICU, for how long, what they did for him, how long he stayed, after discharge any medicine was given to him, did you follow with any team. Then previous hospitalization in normal ward or ICU, what done, investigation and medications given on admissions, which team following with. Perinatal, lateral, postnatal history very important about the fetal movements, polyhydramnios during pregnancy, amount of liquor around the baby, any feeding difficulties in early neonatal period, any admission to the NIQ. Vaccination very important, missing any shots, any extra shots, allergy, nutrition as usual, development, is he look like his peers in way of talking and walking. Family history about the consanguinity, how many children, history of similar condition, history of deaths in the family, especially autoimmune disease, especially mother side. So history of any autoimmune disease we will ask. Social and finance, what did you do for a living? Is it satisfied for you? Did you have any easy access to hospital? Who take care of the other kids when you go to the hospital with? Do you have insurance? Receive any support? School and psychological and impacts. So discussion about the myasthenia gravis DDR, we can keep myopathy like Duchenne muscular dystrophy, Becker muscular dystrophy, juvenile dermatomyositis, hyperthyroidism. Others are GBS, neuromuscular any disease, Horner syndrome. Drugs are botulinum, organophosphorus poisoning, ptosis. Bilateral ptosis causes Noonan Smith, Lemley Opitz, Robinson type B, bilateral third nerve, cranial nerve palsy, migraine, and craniosynostosis. Craniocystinosis. Unilateral idiopathic trauma, infection, tumor, retinoblastoma, congenital ptosis, unilateral third cranial nerve palsy, Horner syndrome, Marcus-Gunn syndrome, local pressure on the eye. So mainly myasthenia gravis, difficulty in walking, the problem, easy fatigue, something. So our top, we can keep myasthenia gravis because it's a chronic condition. GBS we can keep, but we know GBS is an acute conditions and some features are different. And also Duchenne muscular dystrophy, Becker muscular dystrophy you can keep, juvenile dermatomyositis, myopathy any causes. For eye, Horner syndrome and syndromic features, some are because of ptosis present. So this is all about how can we take the myasthenia gravis history. Thank you.